Hey there VCHHD students, my name's Andy, I'm a VC Health and Human Development teacher. In this short video we're going to look at answering the 2020 VCHHD exam question number 7. Before we dive into question 7, just a reminder over at the Health Resources Hub YouTube channel, a new video like this one is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know they can do so too to get access to all of those videos. I'm running the 2 ACE HHD exam preparation sessions over the September break coming up. There's less than a week away until the first one. You can book a spot to those at book.acedvc.com. You can see our social media links there if you'd like to follow us and get alerts to new videos coming out each day, and also our email. You can see here that question 7 in the 2020 exam was worth 11 marks, and it started with some stimulus material, which was a graph about the number of people per 1,000 admitted to hospital based on socioeconomic status. And so you can see along the x-axis here, socioeconomic status, and the y-axis, number of people per 1,000. And you can see there's a key there for public hospital in the black bars and private hospital in the white bars. So A for 2 marks was asking you to outline one relationship between socioeconomic status and the use of private and public hospitals that is evident in the graph above. So you can see here that as you move from lowest socioeconomic status to high socioeconomic status, the number of people admitted to hospital per 1,000, okay, for private hospitals increases and for public hospitals decreases. So that would have gotten you 2 marks for that question there. So just remember, a relationship is asking you, as you look at 2 variables, so one on the x-axis and one on the y-axis, what is happening as one changes. Okay, so as you move from low to high SES, private hospital admissions per 1,000 increase and public hospital admissions decrease. So then B was asking you for 4 marks to explain the benefits of private hospital use to Australia's health system in relation to sustainability and access. So 2 marks for sustainability and 2 marks for access. Now you can see this was a really challenging question for students, with only 3% of the state able to obtain full marks. And it mentioned there in the examiner's report that many students could identify an aspect of sustainability or access in relation to the use of private hospitals, but few could make links to the benefits to the health system. Instead, they linked the benefits to individuals accessing private hospitals. So you can see here they've provided a high scoring response, and for sustainability they've mentioned that by having private hospitals allows those who are able to pay for private health insurance not to be sent to public hospitals. Therefore, the amount of money being paid by the government to hospital people is decreased, to hospitalised people is decreased, therefore allowing it to be sustainable as the government can pay more people, okay, pay for more people as the years go on. Okay, so linking into sustainability sort of in terms of now and into the future by using that phrase as years go on. And so for access, they mentioned there that having the 2 different hospitals allows for more people to seek access to hospitals, as there's more spaces in public hospitals, as those with private health insurance are sent to private hospitals, therefore allowing access to public hospitals for those who need it most. So those are the kind of sample responses that you could have used. So definitely make sure that you review sustainability, access, okay, funding and equity in relation to the different parts of the Australian health system, because they're often aspects of the exam that are not answered well. C was asking you for 2 marks to identify 2 differences in health status between high and low SES groups. So you could have said something along the lines of high SES groups are likely to have a higher life expectancy than low SES groups. That would have gotten you 1 mark. Or you could have said low SES groups are more likely to have higher mortality rates for conditions such as cardiovascular disease compared to high SES groups, and that would have given you a 2nd mark. So there's lots of differences you could have listed there. You had to think ahead, however, because D was then asking you to identify one environmental factor and explain how it might contribute to one of the differences you identified in part C. So you had to make sure you're able to choose an environmental factor you could link back to one of those differences. So remember, there's lots of different environmental factors. And so you can see here an example they gave in the examiner's report was proximity to fast food outlets. You can use things, however, like housing and infrastructure. And so their explanation for this one was that low SES suburbs often have a higher density of fast food outlets when compared to high SES suburbs, and that makes energy-dense foods more available to low SES suburbs, contributing to this group consuming more of these foods, and therefore, as a result, rates of obesity and related conditions like type 2 diabetes are likely to be higher amongst this group, contributing to higher mortality rates experienced. So they were linking back to higher levels of mortality, in low SES groups for conditions like obesity and type 2 diabetes. So that's a good question to practice, because that's a common way that this type of question regarding the different factors and the population groups pops up on the exam. Okay, hopefully you found that useful. A reminder, Health Rethoughts of the Hub YouTube channel, the ACE HHD exam preparation sessions, our social media links, and our email. Thanks so much.